Thank you for tuning in to watch our Invest Tampa Bay 5th Anniversary Launch Conference. You're about to watch panel number 3, Innovative Care, how Tampa Bay is becoming a national hub for healthcare innovation. Enjoy.
Thank you, Abby. I'm honored to be here today, but I need to start out and say something that is probably obvious to all of y'all. Paul Allen, I'm absolutely convinced that you and I were about to be best friends, because you said that over time here, a very short period of time, that there were going to be more female entrepreneurs and millionaires than males. And I'm sitting back and saying, I got a beautiful wife, I got beautiful twin daughters, so I'm in great shape. And then you said that I have to die, and the husbands that they haven't even met yet have to die for me to be in that. So you have plenty of friends here, Paul. It's not going to be me anymore. So, look, we have an absolutely world-class panel here today, and I'm excited about that. Given that the prior two panels, which were excellent, can't defend themselves, I'm going to go ahead and take the liberty of saying we have the best panel. We're going to end this with a bang, and I know that we're holding you up right now between now and a cocktail, so we're going to try to keep pace, but there's some very cool things we're going to talk about here. So we have John, Alicia, and Andrew here. They have done very cool things. And one of the reasons I love capital analytics and Abby and Shane and what they do with Invest Tampa Bay is look at the title here of this presentation, right? We're already renowned in Tampa Bay. Not that how are we going to become renowned, but we're already renowned. And the truth is, if you look across the board here, you look at these three panelists here, that's absolutely true, pure, and righteous. We have done some incredible things here to create this healthcare hub. But guess what? If you go to the Northeast, and I have many friends in the Northeast, and I'm not going to hold anything against them, but there may be a little more arrogance and presumption there, and they wouldn't view Tampa that way. So I think that's a great benefit and opportunity for us, because people like this right here, who could be crushing it in the Northeast, are here in Tampa. And one of the things that we are going to talk about is the migration of talent down here, because that helps us, even if they're from the Northeast, right? We'll be okay with them. But so let's start out here, and I have a question for all of y'all, and it really relates to what's happening and how we've become this healthcare hub. So I've lived here for more than 50 years. I've seen Tampa change dramatically over the last 50 years. We get sports teams, our culture's improved. We have the big banks that have come in and acquired some of the community banks. We have other community banks that are being built right now. So we've seen an influx of talent. But healthcare was a little slower to coming here in a renowned way. And so if it's been in the last 5 to 10 years, that's probably accurate. So I want to start to my left with John and ask, what do you think were the triggering events? How do you think that happened, other than you moving here 6 years ago and being a part of that?
You took the words right out of my mouth, Phil. That was great. First of all, I don't think it happened overnight, and you've already talked about that. I think this is sort of decades in the making. So if you think back and you look at the history of where Tampa has been and where it is, Tampa's been developed over decades of really great leaders, both from the public sector and from the private sector. And folks that have called Tampa their home forever should be very proud of that. So I think you need to start there. You need to honor the past, and you need to understand that people have been working on this for a very, very long time. So that's number one. This is definitely not something that happened overnight. Florida, a little bit sort of more relevant, Florida is a great place to do business. It is very business-centric. I have the opportunity, like my colleagues, to traverse the country. I came from the Northeast, from Boston specifically, so when you talk about real arrogance, it's like right there, right? Except maybe Baltimore. But I know, no. Alicia and I are good friends.
We're friends.
Yeah, we're friends, and we're collaborators. No, we're friends and collaborators, actually. We're good partners. But so the second piece is, I think Florida is just a wonderful place to do business. It's a wonderful place to raise a family. And our elected officials at the state and local governments has allowed that to happen. So it becomes super attractive for people from around the country because it's easy to do business. And then finally, this is a wonderful place to raise a family. This is a relatively safe state. It's a law and order state. It's a state that is well organized for the most part. Those things matter when you're talking to businesses that are thinking about moving hundreds, if not thousands of people down here to call Florida their home. So I think when you put all that together, it becomes a really attractive state, and Tampa becomes a really attractive place to bring in healthcare. And I think that's what's contributed to the healthcare sort of trajectory that we're on.
Sure. Thank you, John. Alicia?
Yeah, I'd just build on that. I think it's absolutely what John alludes to relative to the chemistry. I think maybe taking a little different angle to it in the last 5 years, I think there's definitely been a true investment by a lot of the healthcare organizations to build on that legacy that John alluded to, but then to start to look for those differentiators as well, those destination centers. So we've always delivered, and I'll speak to Johns Hopkins All Children's specifically, for nearly 100 years we've delivered that strong care, as my colleagues here do as well. I think what we've looked at is how do we also enhance that care by having some truly niche programs. And as an example for that, we have the world's best, truly the world's best program for a disease state called congenital diaphragmatic hernia. That's a really complicated word, but it just basically means in utero, when the mom is having her scan, they might identify that the diaphragm doesn't go across the abdominal cavity, and so the organs migrate up into the lung area. It compromises the growth and development of the lungs. Our center, if a child's born with this condition anywhere else in the world, they're lucky if they have a 42% survival rate. Our hospital has over a 90% survival rate for these kids. And so I think that's just one more example of how we really look to say, how can we bring the very best healthcare to Tampa Bay area and use that to really be a magnet for folks to recognize, to your point, recognize that we too in Tampa Bay have the world-class leading healthcare.
Thank you, Alicia. Andrew?
Yeah. So here's the challenge with going third in an order of like-minded folks, right? There's a little bit of ground to cover, but I'm going to try something that I don't think any of our friends in the Northeast can do. I'm going to reframe for our Floridians the word perfect storm in a positive way, right? So I believe in Tampa that we have a very unique perfect storm happening in this last several years, built on decades of honoring tradition, as you've alluded to, right? We have a very business-friendly environment, as you've identified. We have a great place to relocate, live, and thrive, as you've identified. But the other interesting thing here is when you have that, you have a premier acute care medicine system, you have a premier specialty medicine system, you have a premier home and community-based medical system. What you have is an ecosystem that other communities lack, right? And if you're an investor, if you're in employment, if you're in technology and innovation, you have a full ecosystem with which to work. That is about as fertile a playground as you can get, right? No matter where else you go in this country, there's other issues that aren't happening in our community that they have to deal with that lessens that environment. And we don't have that challenge because of the history, because of the commitment, because of the similar mission-minded nature of how the healthcare ecosystem in Tampa is built. And so I think that's just something when you step back, you pop into Boston, there's a gap. Pop into LA, there's lots of gaps. In Tampa, there aren't. Right? And that's a big part of what makes a truly thriving ecosystem. And when we get to things around interoperability and others, that's going to come back up.
So I like it. We have some competitive folks up here who put us against the Northeast 10 days out of 10, which I love. So we're going to go in reverse order right now, and back to you, Andrew. Recent data, and really 2 to 3 years old, suggests that a third of all healthcare visits today relate to preventive care, right? So my question to the panelists is, how have you seen that impact our population from a wellness perspective and other perspective? Andrew?
Absolutely. So this is my first time meeting many of you, and here's a little quick insight. I don't mind having a little fun, but we're not going to have it at the expense of our teammates here. So when I paint the rest of the healthcare ecosystem in a little bit of a negative light, which I'm about to do, it's not because it's in Tampa, it's in Boston, it's elsewhere, right? So that disclaimer aside, here's a little dirty secret about the healthcare ecosystem. Wellness is not a sustainable business model for many people, right? How do you fill an ER if you don't have sick people? How do you run scans that generate money if you don't have sick people? When you've committed to building a wellness-driven model, as many of our organizations have done, it looks and feels different, right? And there's the obvious nature of that. The revenue mechanisms look different, the employment mechanisms look different, but now you're getting a workforce that's performing the art form they signed up for. Now you're getting the attention of a government, of payers, of designers who want to do something that drives down cost, drives up quality, and keeps people in their home, which, by the way, if you ask a consumer what they really want, they don't want a bigger building, they don't want a fancier environment, they don't want more tests, they want to be in their home. And organizations like ours, for example, make days in the home their #1 marquee metric. Guess what? That doesn't make a lot of friends in the traditional sense of the word, but if there's one massive insult you can throw at me, pick the worst 2-word statement you can say to someone to let them know how much you really dislike them, call me status quo, right? Probably not the 2 words you were thinking of, but the last thing we need is more of what we have. And I would tell you, in an environment like we have in Tampa Bay, that's why we're getting top talent, that's why we're getting top attention from the federal government, state governments, and payers, and it's why we're able to get the folks that can reinvent things while the rest are stuck in the same circle.
Alicia?
Yeah, and I think just to build on that, absolutely true. I think for us, we also think about, we have kids that are complex care kids, and no matter what, from a preventative care standpoint, we've got to take the best care of them that we can, and we won't be able to change their initially presenting disease state. But we also have a much bigger focus on preventative medicine than we have in the past, specifically through the partnerships with pediatricians. So we think about how can we create those connections across our healthcare continuum. Here at All Children's Hospital, we specifically partner together with our pediatricians, over 125 of them in what's called a clinically integrated network, and we look to share best practice. Among folks that used to be, or probably are, often competitors, it's how do you bring that evidence-based medicine forward and create a situation where we have evidence-based protocols, which thereby also give us the opportunity to work more with our managed care organizations and the payers to say, how do we reduce the cost of care? Because we know to create healthier tomorrows for all children, it oftentimes begins in the very beginning through that preventative care process.
John?
So I'm going to take a little bit of a different turn here. I don't completely agree with Andrew, so I'm going to get a little provocative, if you don't mind.
By the way, I saw this coming.
Yeah.
I've had the pleasure and benefit of serving as John's board chair for the past 3 years, so I've been working for John, and I see him in action, and I saw this coming from a mile away.
Yeah. My tell sign was coming out. I don't think we're actually in the health and wellness business. I don't. I think we've made a fundamental error in healthcare. And I'll give you a couple of proof points so it's not just sort of an anecdote that's provocative. If you look nationally, quality is stagnant in the country. It's average, let's just call it that. And the cost of healthcare fluctuates between 17 and 20% of the GDP, depending on the year. That's sort of where it kind of bounces around. I think people like me 20 years ago went to conferences and heard really smart people in conferences around the country, and they said, you're in the health and wellness business. Keep people out of the hospital, keep them healthy, keep them well, they won't need your services, the cost of care will go down, the quality will go up, and life will be good. That was 20 years ago. I'd submit to you that if that was in fact true, don't you think we would see some improvement by now, 20 years later? I mean, think about your own business. If you worked on a business model for 20 years, don't you think you'd see an improvement? We've seen next to nothing at a national level. It just is what it is. I think we're actually in the care coordination business. Think about your own experiences, your own personal experiences. Healthcare is fragmented, it's disjointed, okay? It's siloed. It doesn't really work well. Most of you in this room probably have an Apple device. And if you ask yourself why you have an Apple device, it's coordinated, it's intuitive, it's safe, it's not disjointed, it's integrated, there's interoperability between the different devices, and it's a wonderful tool. You, by the way, would never describe healthcare like that, ever. Not right now, anyway. Now, don't get me wrong. There are health systems across the country that are doing marvelous work. I have the opportunity to traverse the country, and I see incredible work being done in different parts of the country. But the fact of the matter is, it hasn't reached critical mass. So I would submit to you that we're not in the health and wellness business. We're in the care coordination business. And we're not doing a great job at it right now. We are doing a better job than we have in the past, but we've got to get better at it. And I will tell you at TGH and at USF Health, we are really doubling down on care coordination, okay? It's not a matter of when you see us, it's just, or if you see us, it's a matter of when you see us. TGH and USF, we take care of rare and complex work. So there's no question that there are places and spaces like the home where you'd like to do most of your care, but we as an industry need to think about how are we going to improve quality and lower costs in a sustainable, reproducible way and pass that value on to the business owner or the leader of the business. That's, I think, what's in front of us. So it's just a little bit of a different way of looking at it and organizing around it.
Makes sense, makes sense. Thank you. I'm going to pivot just a little bit here because we heard earlier about the advent, not advent hospital, but the advent of more females in the workforce that has transformed our workforces over a long period of time. I'd like to ask each of you how you think about that, given that women make more healthcare decisions than men, I mean, across the board for families and everything, but how have you built your teams and taken advantage of the expertise that's inherent and maybe more peculiar to a woman than a man? John, you want to start?
Well, 70% of my senior leadership staff are women, actually over 70%. And Forbes named us last year the #1 employer for women in the United States out of any industry, not out of healthcare, but out of any industry. That's intentional work, very intentional work. I think women in a lot of cases, in certain situations for sure, make better leaders than men in certain situations. I think women's perspective on things critically important. And so we are very deliberate in the work that we do around that. And we're proud of the recognition we get because we spend a lot of time making sure that we have sort of a well-balanced kind of environment for all sorts of people. I mean, we're an organization that's predicated on inclusion and this idea of belonging. And everyone deserves to be included and belong to the institutions that they work at. And that's, we focus a lot of our attention on that work because not only is it simply the right and just thing to do, it makes great business sense. It really does. So that's a little bit of how we handle it in our perspective.
Yep. Thank you, John. Alicia, you've risen to the top. I know you're going to have some interesting thoughts on this.
Well, I think it's really about focusing on the communities that you serve, right? We have a lot of intentionality around how we communicate with our patients and their families, and then also how we build the culture at Johns Hopkins All Children's. So we have an extraordinary place to work. I admire the Forbes Best Place to Work. I hope that we can compete on that, even though we're friends. But I truly think it really starts with having the conversations, making sure that we're practicing those good listening skills and promoting from within. We have a tremendously strong, as I alluded to earlier, culture that I think embodies the care that we aim to provide each and every day. And that is also, again, an attractor or a magnet to our workforce.
One of the things I really enjoy about spending time with John is he backs his statements up with facts, right? And so when we too talk about being an employer of choice, ours happens to be Fortune and not Forbes, but I think we could all agree they're caliber organizations that testify to what you put into your culture. And so when you have an organization that's purpose-built, and that purpose is the employees, right? Our mantra within, very stern, don't budge from it, is there's only 2 jobs in our HR manual. Be taking care of patients or taking care of those who do, right? So when that's what you believe in, and that's sort of the ethos of your organization, who is out there delivering care? Who is out there making healthcare decisions? Our previous panel alluded to it, right? Many times it is female-led, female-driven. And if it's not female-led, female-driven, it's female-received. So if you're going to have an organization to truly reach the customer and be a reflection of what the community and the customer base wants, who else do you hire? Right? And that's not in a blasphemous way to the male population. It is a well-balanced organization. We too happen to have a predominantly female-led senior leadership team, but with many contributions from all over. And it's not even necessarily just within the gender demographic, right? You still have to be fairly diverse in your ethnicity makeup and your religious background and your societal beliefs, your socioeconomic status, the whole gamut. Because if you're going to serve a community, what you can't do is be part of a community at the leadership table and all of the community from a service side. That doesn't work. That's a disjoint. And none of my peers have it, which is why you are at the top of those employment lists consistently.
I love that topic. I'm going to shift to one right now that I don't love because I'm not a tech guy, but when you talk about data, when you talk about systems, data systems, networks and the like, in healthcare, probably more than any other industry, there's not a lot of interoperability where you can shift information back and forth between different providers, even within a hospital and a system, it's challenged. So my question to our panel, and I'll start with Andrew, is what, if anything, can we do in the Tampa Bay area to improve interoperability so that we can better treat the community of patients?
Yeah. Knowing that John has chosen to double down on care coordination, I'm going to leave a good bit of this to him and save my words for a different question later. But in a short notion, I would just make sure that everybody understands, first off, the word interoperability does not mean you working with you. Right? Interoperability means your ability to work within others, well with others in the ecosystem. That's a big part of it, right? Because so many people make their technology choices based on, will this talk from my clinicians to my financiers? That's fine, that's important too. But if it doesn't talk to the primary care group you're relying upon, or to the nursing home you're coordinating with, or to the consumer themselves, you don't have an interoperable system no matter how seamless it is internally. And that's a lot of what John was alluding to well. So the first question I talked about today was what makes Tampa Bay a great place for healthcare to be delivered? It is the fact that we have systems that have prided themselves upon their interoperability at a social level, at a technical level, at a financial level, at a mission level, right? I know we're framing this question to the context of tech, but interoperability should be a cultural part of your organization. I'm going to let John speak to the tech because I've seen the Care Coordination Hub. It's very impressive, but the reality is, it's two things, right? It has to be a mantra, and then it has to be tech-enabled, and if without them, either of them standing alone is not going to work.
Yeah, and I think I would just add that we need to all make a commitment to continuous research and innovation in our respective arenas, right? We've got to continue to push the edge of science and technology to help work for us. And we have inherently healthcare is complicated. John just alluded to it, but I think we've got to continue to push the boundaries of innovation and dedicate time and resources to doing just that. Oftentimes you don't see that return that we were talking about earlier today in the panels right away, but we've got to make that commitment to long-term investments.
Interoperability, we do as an industry sort of a lousy job in this space, generally speaking. At TGH, I'm biased, right? I'm the CEO at TGH. My chief digital officer is here and my innovation officer, who's our CIO. And so you keep me honest, Scott, on this. But I look at it three different ways quickly. The first is inside our walls. So we are building an ecosystem that basically is completely seamless. Because what we want to build is a patient-centered system of care. Think of your iOS operating system with your Apple phone, just to stay with that analogy for a second. One of the things that is great about this phone, you go out to Cupertino, you talk to them, they'll openly admit there are probably better phones out there in the market, but no one has their operating system, right? So we're building under Scott's leadership, Scott Arnold's leadership, we're becoming the Apple of healthcare for this community. That's what we will be. We'll have so much stickiness with our system that, quite frankly, no one will want to go anywhere else because it is safe, it is intuitive, it is seamless, it is well coordinated, and you can feel that now between TGH and USF and our private practice physicians as we deploy our EMR. We have a very strong relationship moving from the inside out. We have a very strong relationship with All Children's that we're very proud of. We have lots of interoperability between our two health systems, and it's continuing to grow every day. That's also really, really important. And then finally, and I'd even ask you to ask yourselves about your own businesses. Do you compete on analytics? Do you really have the ability to compete on your systems and analytics? We asked ourselves that question 5 years ago, and our answer was no. We can now have the ability to compete on analytics in ways that a lot of our competitors don't, and our analytics and our IT systems have moved from becoming a utility to becoming a strategic differentiator. Now that's been, as you know, Phil, that's been close to a 6-year journey, and I don't think the journey ever ends. It just sort of continues, but that's a little bit of kind of our approach and how we view technology.
So I don't know a lot about technology, but I do know a lot about care and aggregate care. And if I could just take a moment to applaud our local healthcare providers, particularly the academic medical systems like Tampa General, USF, all of our hospitals. When you think about what they did during the pandemic in keeping our community safe and really performing better in the aggregate than any community I can think of, and it's because they collaborated, they worked together. There was no competition during that period. They wanted to care for the community as a whole, which I love. And I don't know how many of y'all know that, but these folks were talking together and making sure they can care for the community.
We have the ability, because at one point, this is sort of just interesting because you brought it up, at one point we were aggregating all of our ICU data. It was HCA, Advent, Bay Care, TGH. It wasn't as much all children's because the children's hospitals handled it differently because kids were getting COVID differently than adults were. But we were actually managing capacity across all these competitor health systems in partnership with the state. And the whole idea is if one hospital got overwhelmed, another hospital could pick the load up, particularly in the ICUs. But the way to do that was to share information. And out of our Care Coordination Center, which is a large 8,000 square foot artificial intelligence and predictive analytics hub, it's sort of our central nervous system for our health system. We were managing that capacity for about 55, 56 hospitals in total across those health systems. And it worked really well. Now, of course, we're in a hyper-competitive state in healthcare, so as soon as the pandemic kind of subsided, we went back to sort of operating in our old paradigms and took it all back because we were convinced that they were stealing something from each other, and which was not nonsense. But you're absolutely right. We have the capability. What it showed us is that we have the capability to do that kind of work.
Which was great. So I'm going to pick on our individual panel members now. And Alicia, you're first, okay? As the leader of a very leading edge organization here, and you're starting to incorporate telemedicine and virtual care. How are these innovations helping you, the overall community? How are they changing the overall expectations of healthcare outcomes? And what challenges do you see in the future when you try to achieve all those things that you've set out to achieve? Broad question, I know, but you can handle it.
17 questions in one. So I think there was a silver lining of the pandemic, and that was what we just talked about in terms of how it accelerated the entire healthcare system's adaptation and adoption of virtual and telehealth. That has been a key mantra of ours. We believe very strongly in what Andrew shared earlier, and John's team also is doing, in keeping and bringing care closer to home. That's important for our patients and families. So that telemedicine adaptation grew significantly during the pandemic. Now, maybe to some of the panelists earlier today in the discussion, unique to pediatrics more so than adult, I've been on both sides of that equation. The adult system is probably a little bit more familiar and acceptable to utilizing virtual and telehealth. Parents still like to use the person-to-person, if I can pull that phrase from earlier, communication and visits with their provider. So it's given us the opportunity to expand it. I don't think it will ever probably have the adoption as the adult system does, because that's just what we're seeing nationally across pediatrics and telemedicine. But I do think it allows us to do a lot more. We, as John alluded to earlier, we have a lot of collaborations with Tampa General and other providers throughout the state of Florida, and we oftentimes utilize telemedicine to do virtual consults between our providers. That does a lot for the communities, particularly those that are underserved or just frankly don't have the resources to have the level of specialization those of us in the Tampa Bay area do. So it's brought us a lot of opportunity for innovation. I think there's still a lot more that we can and will do, but it will definitely be in part the comfort level of our parents.
Thank you, Alicia. So Andrew, you're next. Okay, you talked a little bit about collaboration before. And when you think about the kind of collaboration necessary among our healthcare community here in the Tampa Bay area, lots of challenges, lots of opportunities. So my question to you is, how has that resulted in innovation that's beneficial to our community? And how are you thinking about that at Chapters, more importantly?
Yeah, I mean, so when you talk about innovation, right? There's obviously the incremental, and then there's disruptive, right? A great deal of traditional healthcare, if you can kind of box things into traditional and non-traditional, is incremental. It's doing things a little faster, a little cheaper. To John's point, it's the same thing happening over and over and over again, which we know Einstein would define as insanity. Then you can take a Tampa Bay ecosystem and do things like care coordination to keep people in the home, to further drive wellness, keep babies safer, right? When you get an interoperable or a collaborative or whatever term floats your boat, you're starting to move the whole thing together, right? So Chapters has, we'd like to think, filled a gap that maybe other communities have not had filled, right? Really great acute care infrastructure. Terrific, right? Moms and babies cared for, because who wouldn't care for mom and baby? But when you go back home, what happens? You wait for something bad to happen, and then you start the whole process over again. So, if you're in your home 200-300 days a year, and in the acute care environment a few days a year, where's the real opportunity? If you really want to change how things are done, you really want to innovate. So we had chosen to make that our blue water, right? And my eternal optimistic nature said, listen, that great part about that is you have 80% of a year to play with, where somebody else has to make their mark, and much less percent of a year to play with if you want to change healthcare. So we've gone very aggressively into the space of taking what they call risk, right? Give us the lump sum of money, we'll be responsible. We'll guarantee the good outcome. If not, it's on us. That sells real well to the federal government. That sells real well to payers. That sells real well to acute care partners who say, listen, we're going to do what we do, but boy, now we can maybe step out with you, and we can be a little more innovative alongside, because those other 300 days a year, somebody's got eyes on people in their home, right? So we don't look at it as standing alone. And if I was a little bit antagonistic with John, it's because I know he'd forgive me, because we're not standing alone. We can't do this if we don't have great partners, but that's not always how healthcare works. You said it, it's siloed, it's fragmented. Are you stealing my stuff? Right? And that's a real thing until it's not. And we'd like to think that in the Tampa Bay community, it's not, right? We've built something that, as you look across this, rarely would we have anything that would be a conflict over a patient population. I want them when they need my environment, and when they can't need my environment, I need John's team. I need to make sure, and heaven forbid we have a sick mom and baby. Guess what? I am terribly ill-equipped to handle that. She's not. Right. So not all of our communities out there have that. They don't have this non-duplicative, I like to think of it as interoperable type of health system. So it's maybe not innovation in the way that some code was written, right, or some patent was filed, but it's innovation in the way of saying, we're not going to do what we've always done. We're going to do it different, and that will drive a different result. So we don't 20 years from now sit here and say, remember 20 years ago when we were lenting, it wasn't working then? Yeah, it's still not working now. This is what innovation meant to us at Chapters.
Perfect. Thank you, Andrew. So my second and last question, because I think we're being given the hook here. We have some thirsty folks out there. But to John Corus, for those of you who don't know, there is something happening along Kennedy all the way into downtown, and it's called a medical district. Now, I know there's a lot of thought that's gone on behind this, and I know there's one person here on the panel at the end who's been very involved. I want to know how you think about the medical district in Tampa, how you think it's going to transform our community, the care we provide, and the national prominence, and how are we going to remain this renowned hub here as a result of the medical district?
So I think this goes into the category of sometimes we're prisoners of our past lives. And when I was a young assistant administrator, where I really got trained in Boston, where I'm originally from, at the Massachusetts General Hospital, and at the Brigham and Women's Hospital, because they're part of the same system called Mass General Brigham. When I came here, I saw what we had on Davis Island, which was it's actually one of the largest freestanding academic health systems or hospitals in the country. It's close to 1,100 beds. We're on our way to 1,300 actually beds on that campus. So I saw this really great medical center. Then I saw USF Health and the College of Medicine just getting finished in Water Street. And I thought to myself, this reminds me a little bit of Longwood Medical Center in Boston, where you had Harvard Medical School next to Brigham and Women's, next to Dana-Farber, next to BI Deaconess, next to Joslin Diabetes Clinic, et cetera, right? And I thought, I turned to our dean, Dr. Charlie Lockwood, who's a very close friend and a great partner of mine. And I went, at the time, it was Judy Genshaft, who was president of the university. And I said, I got an idea. What if we started to build a medical and research district in the city itself and start to give Tampa an identity around academics and research and world-class care, like Longwood Medical Center in Boston, like the Texas district in Houston, like Illinois Medical District in Chicago, and the list goes on from Baltimore to San Francisco, et cetera. And so we started to do that. And the whole general thesis was, if we can build an ecosystem in the city that can attract world-class physician scientists, biotech, clinical research, venture capital, private equity, and start to bring them in through a concentration of research and medical excellence, not only can we improve how we care for people in this region and state, but we can also create an environment where the entire broader economy improves. Because when you look at the data, you can see places like Longwood Medical Center, which we just went with the Chamber of Commerce. We spent 2 or 3 days there and had a wonderful time, one full day at Longwood Medical District, learning from them, okay? You can elevate an entire economy and you can elevate it in a way that is resilient and can kind of withstand the undulations of some of the challenges we have in our own state, being heavily on the service side. And I'm here to tell you that it's working. We've got a dozen clinical services, if not more, in the district today. We're tying together Ybor to the Kennedy property, where we're building 2 hospitals, out to our main campus, over to Armature Works, and back to Water Street, which, by the way, is about 2,000 acres, okay? Not all owned by us, but it's a city. And finally, we're going to be tying into public schools, tying into independent schools, tying into the arts. Culture is so important when you're thinking about healthcare and the broader economy. So that's the journey that we're on. And some of the early indications tell us it works and it's real. And so that's the journey that we're on. And I'm really very excited about the work that we have ahead of us, because we're just getting started. We've been working on it for 4 or 5 years quietly. We've just recently become real public about it.
And imagine if we can get some of the top 40 companies in America to come down here and build in that medical district, what Tampa would look like relative to the rest of the country. So on behalf of the entire panel, I thank you. You're awesome. Great answers, great dialogue.
Thank you.